in the United States, one person at least has a heart attack every 40 seconds. Can you believe that? That's actually a fact from statistics. Some of these people are experiencing it for the first time, and another set of people are experiencing for the second time. And it is also said that 1 in 5 of these attacks are usually silent. The individual does not even know that they have had a heart attack. Well, so it all starts with blockage of the coronary arteries. They are the arteries that supply the heart, supplying the blood and oxygen that makes the heart itself to function. Even though, as you know, the heart pumps blood to other parts of the body, but it also contains blood vessels which helps it to perform its own function. So when any of the arteries supplying the heart muscle gets blocked, then that part of the heart begins to die. So this is the way it happens. It begins with formation of plaques. A plaque is a fat deposition in the walls of the blood vessel. So when this plaque formation occurs, it can actually lead to a tear in the blood vessel, and that means a rupture that can cause bleeding, and that bleeding may actually form a clot, further obstructing the flow of blood and of supply of oxygen to the heart muscles. If the death of the heart muscle is not arrested, then it can eventually lead to a heart attack. Yes, even though many people talk about fear, anxiety, yes, there are actually possible causes. This is the way they may cause a heart attack. When a person is fearful or anxious, this may lead to a rise in some chemicals in the blood. And these chemicals are adrenaline, cortisol. So when the levels of these hormones increase, they may then be responsible for increasing heart rate, increasing blood pressure, which may eventually affect the heart, leading to a heart attack. Those are two major ways by which a heart attack happens. Studies have shown that people who are actually anxious, people who go through stressful situations, are likely to develop a heart attack. This is very important, so to help you be able to put in measures to avoid these conditions that may put you at risk of developing a heart attack. So from the blockage that has caused a reduction in the blood supply and oxygen supply to the heart muscle, an individual with a heart attack or suffering from a heart attack will have the following symptoms. Most of the time, chest pain, which is usually described as crushing, may be described as the pressure on the heart, like a squeezing form of pain, and maybe severe, and may actually radiate to the neck, the jaw, even to one or both arms. Some people may describe it as radiating to the back. At this point, the individual may not even be able to talk, and this must be recognized as an emergency situation. Another symptom is lightheadedness, palpitations, hearing the heartbeat, nausea, breathlessness, and some other symptoms. So it's important to recognize the symptoms so as to know when to seek medical assistance as soon as possible. As I mentioned, this is a medical emergency and requires urgent medical attention. Statistics have also shown that heart diseases, cardiovascular diseases, are the leading cause of death globally. So it is important for us to look at cardiovascular diseases. About how to prevent a heart disease, how to have a healthy heart. It's also important to note that of these cardiovascular diseases, 85% are due to a heart attack. So it is very important to know about this especially now that even developing countries are moving into westernized diet, which has been a major risk factor for development of medical conditions that have predisposed many to developing a heart attack. Lastly, I will talk about what puts an individual at risk of a heart attack. A number of medical conditions have been identified to put an individual at risk of developing a heart attack. I'll just mention some of the medical conditions: diabetes mellitus, type 2 diabetes, hypertension, dyslipidemia or hypercholesterolemia, high cholesterol levels, overweight or obesity, cigarettes, tobacco smoking. Other conditions that may put an individual at risk of developing a heart attack include physical inactivity and, of course, unhealthy diet. So if you have any of these medical conditions, you need to pay attention to your health, adhere to your drugs, follow the doctor's prescriptions, and plan for follow-up management of medical conditions. These conditions need to be managed well to avoid developing a heart attack. I will be explaining in subsequent videos how your diet can lead to development of a heart attack. Thank you for watching. If you are yet to subscribe, kindly subscribe so that the algorithm can push this video to more people, so that more people can have access to this important information about our health, our lifestyle, and live well to do life as God has given to us. Thank you for watching. See you in my next video.